Okay, Joss, I need you to join me. So let me see. I've got you there somewhere. Oh, right, okay. Jocelyn, is that you there? Right, let me see. Can you hold on? Right, now we're in. Right, I think if it worked.
Yoo-hoo!
I love the way we should do these close up. Look at our glasses. Look at
Ooh,
that for instance. Ooh, we'll freak
good
people.
taste.
We'll freak people. Yeah, absolutely. Only way to be. Right, well, I'm glad we've got this bit sorted. So all we need to do now is sit here and twiddle our thumbs. Did you have a nice day?
I did, thank you. I just Googled it. Our niece has just had a little baby son called Spencer, and so he's our grand nephew.
Oh, lovely. Congratulations. Oh, that's
Thank you.
exciting.
Very.
That's a good bit of news for today. Were you working today?
Yeah, yeah, working today. What about yourself?
Oh, accountant day. Not she's a brilliant girl, but it's always one of those things you worry slightly, what the consequences of your actions are going to be. But yeah, it had to be done. Growing smile stuff, getting ready. I'm going to Birmingham in the morning to lecture to
Oh,
some students in the dental hospital, which is where you're going in November,
oh my
isn't
goodness,
it?
that CPD suite's amazing.
Is that they have got the most phenomenal resources in that place, haven't they?
Fabulous,
It's
fabulous. And the guy
um,
George who's running it, he's so helpful. So it was just so easy to sort everything out with him.
Oh, well, that's good. It makes such a difference when you've got that, haven't you, Just really? Yeah. No, I will have, I think it's actually the first year hygiene therapy students tomorrow. So I will,
Exciting.
yeah, so I'll go and torture them for a little while. So flight in the morning, flight back tomorrow afternoon. Is that
Lovely.
somebody bringing you a nice cup of tea?
My husband's on the Facebook page. I think we might be live.
Yes, we are live, but this was us being early because we were going to be organized so that I was not going to have logistical
Oh,
nightmares. I woke up in the middle of the night last night thinking, this isn't going to work. We're going to have problems with this. Our broadband is known to be absolutely dire. So,
oh, well,
yeah,
it worked
anybody
last
that's
week. It worked brilliantly.
yeah, well, yeah, mainly for you. So, listen, anybody that's joined us, just to put you in the picture, we have Jocelyn and I have logged on early so that we could make sure that everything was working. And we're very pleased that it is. And we
Had a
are
cup
going
of
to really kick
tea.
off. Oh, she got her tea. I've got my water. I managed to get my tea finished before I come up the stairs. And I'm just hoping that we don't have a thunderstorm in the background here because we've got torrential rain at the minute. It's
Oh no.
absolutely horrendous. We should do a meteorological survey of the United Kingdom and anywhere else that anybody's joined us from because it is absolutely horrible here. Have you got sunshine?
We've had beautiful sunshine today. It looked very dark and cloudy, sort of mid to late morning, but the rest of it has been gorgeous, really gorgeous.
Oh,
So
yeah,
sorry,
yeah.
sorry,
No,
sorry.
it's all right. I think tomorrow's meant to be a good day, and of course, I'm going to be somewhere else. Work out the logistics of that. That's sod's law. I'm going to see if I can pull us up here on my laptop so I can keep an eye on things. Mainly because I'm worried that somebody is going to ask us a question and we're going to miss it somewhere along the way. So, yeah, see more. You're actually much better at this logistical stuff than I am, Joss.
Oh,
All
I don't
this
know.
techie stuff. No, you're really good with it. So I'm just going to see if I can bear with me. We do have
That's
to
okay.
deal with the very end of the line broadband here. You know, we can watch super fast broadband go zooming down the other side of the road, but it doesn't stop with us. It's very unfortunate.
You need to do
Yeah,
something about that.
I know. Well, we're trying real hard, but yeah, we are having problems with that. But anyway, anybody who's actually tuned in early, what I want you to go and do is I want you to start breathing through your mouth. I don't want you to breathe through your nose. I want you to either hold your nose or try really hard not to breathe through your nose, because that'll give you a bit of an idea of what it's like with a dry mouth. And you've actually got a really good thing you do when you're speaking to people, don't you, Jocelyn? The cracker thing.
The cracker challenge, yes. So the cracker challenge, I came across this when I heard Chris Curtis from the Swallows Head and Neck Cancer Charity speak last May at the dentistry show, and he talked about the cracker challenge, and it challenges you to trying to eat cream crackers, and the world record is 4 in a minute. So if you try and do that, you'll be lucky if you can maybe get 2 or 2.5. And some people, especially for head and neck cancer patients who've had cancer treatment with radiotherapy, it can knock out their saliva glands, and this is how dry they'll be for a very long time. So some people get these kind of symptoms for a short time, but it just makes you realise how uncomfortable it is without saliva. Saliva is very important.
Yeah.
So
I always
yes,
describe
an article called the cracker challenge.
Yeah, a cracker challenge. It feels a bit like sandpaper. Or if you've been out, had a few drinks, not that anybody that would ever join us on a live video, that not that anybody would ever have a drink, but if you've had a few drinks and gone to bed and you're waking up in the morning, you're a bit dehydrated, imagine being like that for months or even longer. Some people end up like that permanently. Is that right, Joss?
Absolutely, yeah. Some people are permanent. Sometimes it's short term for patients living with cancer. Sometimes it is literally just through their treatment, and they can often find their saliva can come back once the treatment's completed. But for a certain sector of patients, that can actually go on long term. So it can be very difficult. So this is where we give them lots of things to try, see what they prefer, and just try and make their mouths comfortable, really, because saliva is very important. You never really realise normally how dry you are until you're really, really dry. So it's best to try and catch something early, try and keep hydrated. And we all, my husband's just eating some crackers through the window. So what we'll try and do is throw lots of...
Get him to do it in front of us.
Oh dear, but yeah, so the cracker challenge, you need to do this with your students tomorrow.
Oh yes, that's a good idea. I'll buy a packet of crackers at the airport and make them do that in the morning. So anybody from Birmingham Dental Hospital who's listening at this moment in time, be aware this is what we're doing tomorrow. Because I haven't a clue what we're doing, but yeah. Folks, anybody that's joined us early, just to put you in the picture, Joss and I are basically having a bit of a chat, because I know we have sort of been very much saying that we're going to kick off at 7, so I don't want to end up, because we've talked about something, I don't want to end up then us not repeating it because we've already said it, and people who have joined us at 7 o'clock actually missing something. So maybe, I mean, I'm just thinking, we've talked about the cracker challenge. I mean, the whole idea is this evening that people get information that's going to help anybody that has any sort of cancer, because I think a lot of people think, you know, the problems with your mouth only relate to mouth cancer. Josh, you could maybe elaborate a wee bit on that one.
Yeah, probably about 4 years ago, I was finding that a lot of my patients that were coming back to me after treatment were telling me how sore their mouths were, but also how dry their mouths were. And so I went on a little hunt after a lecture to see what literature I could find, to see what I could do to help my friends, help my family, and definitely help my patients. So it was quite interesting at where the nuggets of information were, but it wasn't really very easy to access. So I asked lots of specialists, lots of questions from lots of different hospitals, anybody who worked in oncology, any nurses, anybody who had anything to do with any patients. with their cancer care. I really needed to find out as much information as I could. This wasn't really something that we were taught about when I was in training many years ago. So I've been learning all the time. I've been qualified in dentistry for over 30 years now. But this is really important because a lot of patients, a lot of friends, a lot of family are going to be diagnosed. They say 1 in 3, it's going to go to 1 in 2. So a lot of patients are going to be diagnosed with cancer. We are surviving a lot longer. We have a much older generation. And so we need to be looking after these mouths for long after the treatment, because a lot of people are surviving and living a long and healthy life. So it's about keeping the mouth healthy, not keeping it as a separate entity. So there's various things that we can suggest to help. So yes, I went on a little personal rampage getting my information together.
Isn't it funny how you and I, our brains, I think, work quite similarly? For anybody that doesn't know, Joss regularly pops up on Talking Teeth Thursday with me. And anybody who's involved in dentistry cannot not know Jocelyn these days, because she has been flying the flag for mouse cancer awareness as if she's got the cavalry and the whole military tattoo thing going on behind her. And I mean, it has been absolutely fabulous because you have raised awareness in the most phenomenal way. And I think now, what I wanted to do by having my very first guest on Talking Teeth Thursday, because we've been doing this for over 2 years now, was have somebody that was really going to help patients and individuals, not necessarily make it very dentally, you know, for dental professionals, because I think you're doing the most wonderful job on lectures and training on courses and things at the minute for the profession. But I think for the people that are actually in the street, it's starting that conversation. And Jocelyn thinks like I do. I will talk teeth anywhere, and anybody who's ever sat beside me on a plane, a train, an automobile, you name it, we always end up talking about teeth. My kids, do your kids cringe when their friends ask you? Yeah, and they go, oh,
they know an awful lot about
Mom.
toothbrushes, electric toothbrushes. They know a lot about foods and diet and things like that. They're normal kids, totally normal kids. But yeah, my family are very wired when it comes to teeth. So
They subliminally absorb, don't they? Yeah, I think ours do too. Yes, my son is actually married to an American, and his great claim to fame is that, you know, because we always talk about the Americans' teeth being far better than ours. And he always says we have one filling between us, and it's not in my mouth. So he's quite funny. That's his great claim. You see, the American has the filling, not him. But we just sort of, I think probably we've a couple of minutes yet, John, so we probably should just chat onwards and sort of just hopefully let people gather, because I don't really want to get into the whole thing of what we'd planned much before 7, really, because I sort of think if anybody's made the effort, they're right, okay, they're going to get the kids in bed, they're going to get a cup of tea, they're going to get themselves organised. So anybody that's already joined us, and if you want to sort of have a comfort break of whatever that might entail, please feel free to go now. And then I am going to start introducing Jocelyn and kick off the whole thing, asking her a couple of questions. So the whole idea is that people get involved. So if you've got questions that have been rocking around your brain, either for your own care, for somebody you look after, or somebody that you might treat, whatever your background, whatever your interest is in this area, we have one of the most experienced and most interested experts with us this evening. And as I say, hi Sam, for those of you who this is your first visit to Talking Teeth Thursday, we do this every Thursday. At least I do this every Thursday. And usually on a Wednesday evening, I'm sitting going, what am I going to talk about this Thursday? So it's really nice. I feel as if I've cheated today, because I'm going, I don't have to think about anything tonight, because Jocelyn's going to be here. So I pick a different topic every week, and what we do is basically you have access to an oral health coach that answers questions about any aspect of oral health. Some people tend to use the live chat function that we have on the Growing Smiles website, which reminds me, because I just want to turn that off. Otherwise, I am going to be trying to do a split personality thing, which is not a pretty sight. So we can ask questions, and we try and help people improve their oral health by improving the routine at home. Now, Jocelyn, I think this is actually how we met. You popped up on Talking Teeth, and she has been the most amazing supporter of Growing Smiles and Talking Teeth. And you'd written to me looking for some products Do you remember
That's
way
right.
back?
It
So, you
was.
know, you never know where you're going to meet people. And I mean, of course, if we can always help, we always will help. But certainly that is where we've all sort of come from. And anybody, whether you be a carer, whether you have cancer, whether you're looking after somebody with cancer, or you just want to know a bit more, we are really, really honoured and privileged to have Jocelyn Harding, who's dental hygienist, with us. Jocelyn, do you maybe want to introduce yourself and tell us a little bit about your background and really give us the credentials there, because you are the woman. Please.
Okay, so I'm Jocelyn Harding. I'm a dental hygienist. I've been in dentistry for 31 years. I qualified as a dental nurse and then dental hygienist whilst I was serving in the Royal Navy. Very proud of those 9 years. I did a lot of traveling around the world, met lots of amazing people, worked with different specialists. It was a great time to get lots of experience and working with lovely, lovely colleagues. So yes, I got into teeth probably about when I was about 15, really. I did work experience at the practice opposite my school, and that was it. So from there on, I then started my willingness to get into dentistry. And so I joined the Navy at 19 and did my 9 years. And I still keep in touch with quite a few people still, which is rather lovely.
That is
And I
nice.
then came to, oh, it was great. It was just a great time. I volunteered for everything. Any job that was going, I would be volunteering for it because I couldn't see the reason why not. I worked in oral surgery. I worked in general practice. We did orthodontics. We did all sorts of areas of dental care. So I was very lucky to get that experience. And it's helped me with lots of other jobs and lots of experiences. I can pick up those little nuggets that I learnt many years ago.
Mm-hmm.
Then I left when I was 28 because I did my 9 years, and then came into Civvy Street. So this is where I worked with a much larger range of age group of patients, many younger patients, many older patients. The younger patients when I was serving was only when I served abroad. So it was lovely to see youngsters every day. I worked with ex-forces dentists when I came out, so we had a good ground level together. And
Mm-hmm.
yeah, moved from Wiltshire to Gloucestershire. And this is where I am now. So I've been here nearly 20 years now. And yeah, it's been a long, hard journey the last 4 years, but really, really amazing. I've met some amazing patients, been to lots of patient groups. I've been to speak to many specialists, many people I can sort of ask and pick the brains of because we've all got something to share. And in the dental world, we're not people known for not talking. So we all like to talk quite a bit. So especially when it comes to
Yeah.
teeth and our angle on things. So yes, I've been trying to sort of improve things really for the mouth care of cancer patients for all cancers. So anybody who's treated with cancer might get symptoms of the mouth. So it's important that we look after the mouths because once they finish treatment and beyond, their mouths need to be healthy. So it keeps them healthy. So
Right.
exciting,
Well,
exciting things.
yeah. You have obviously had a very colourful teeth life to this point. And it's really funny that you say 15 because actually probably it was around 15 that I suddenly twigged that actually this was where I wanted to be. I mean, I was born, sometimes I say that I was actually born in a dental practice because my dad's practice was in the house. So we earned our
Right.
pocket money.
Right.
Do you know little cribs that hold dentures and orthodontic bands on, or the Adams cribs? Yeah, we used to earn our pocket money that way. Sad childhood that we had. The child labour laws had not gone out in Belfast at that time. But anyway,
Oh,
moving on. Right, okay, Johnson. I have just been say, I know this hypothetical, I have just been diagnosed with cancer and I have come to for my dental checkup. What do I need to know? What I'm probably still in shock. And what advice would you give for people who've had diagnosis of cancer of any form, either of the mouth or any other part of their body? What do they need to do before they even start treatment? Is there something they can do to make it easier?
It's coming across the doorstep and talking to the practitioner. So what I like to do, if my patients have had a diagnosis of cancer, we want to try and encourage them not to ring up and cancel their appointments. I want them to come in so I can have a look before they start their treatment. Ideally have a checkup so that they can make sure that all the teeth are sound. We can check around the gums, make sure the gums are as healthy as possible. The oncology clock does not stop, as I was told last week, which is absolutely right. So ideally, we want patients to be coming regularly to the dentist anyway. So hopefully if the mouths are at a good level and teeth are great and the gums are okay, then they can go through their treatment and we see them at the other end. I would like patients to come in, give them good oral hygiene advice, show them the toothbrushes they can use if their mouth becomes sore, get them into a good routine with toothbrushing, with toothpaste, various little hints and tips, so not to spit, to rinse, not rinse, but to spit the toothpaste, so we leave some of the fluoride toothpaste hanging around the teeth. Potentially get them using brushes between the teeth if they've not been using them before. Lots of different hints and tips to get their mouth as healthy as it can be before they start their treatment. That's always the aim, but the mouth is always, well, tends to be, if there's like a big, I won't say drama, but if there's some sort of upheaval in somebody's life, the first thing that will often go is oral hygiene. So it won't necessarily be top of people's list. They just want to get, they're on that mission to get through their treatment and their mouth isn't necessarily a priority for them.
And yet, I mean, I've heard that people are told that, you know, to expect a sore mouth when they're having treatment. You know, why is that? What makes their mouth sore? I mean, why would it be uncomfortable? You know, is it the teeth? Is it the gums? You know, is it the actual treatment? Even though they're maybe not having, if their chemo or their radiotherapy is not even actually from the neck up, you know, is that going to affect them? And what, you know, would it be sore, and what could they do?
Well, the thing to remember is there are over 200 types of cancer and subtypes. And what you also need to also remember, there's 100 types of chemotherapy. So there can be a combination of surgery, radiotherapy, chemotherapy, different kinds of therapies, targeted therapies, many different ways of looking after cancer patients and treatments. It may potentially affect their mouth, and they may get something called oral mucositis, which is where the mucous membrane can be very sore. It's a bit like Sonia Hoy was a nurse that I met recently, and she was saying it's a bit like when you burn your mouth with pizza. It can feel like that, but more. So it's important that we keep the mouth as healthy as possible, keep it nice and clean, keep the risk of infection low, because with the chemotherapies, it immunosuppresses you. So you're going to react to any bacteria that's around. So we need to try and keep the bugs in the mouth at the healthy end of the scale rather than the mature, not so great bugs there. So it's with good toothbrushing and good oral hygiene.
Is there something that actually, I mean, is there any particular toothbrush that you can use, or is a mouse rinse wise, any particular toothpaste, particularly if they have got a mucositis, which sort of they've maybe got an extensive mucositis, which is quite ulcerated, and, you know, their cheeks are sore, their tongue's sore, you know, eating's a problem, and that's obviously going to impact their nutrition. But, you know, what would you recommend as far as sort of electric toothbrush or manual toothbrush?
Well, personally, I don't mind what people use as long as it works. If it's a good manual brush, you need to remember to change it regularly. There are many different types. Use whatever suits you. As long as it's cleaning everywhere effectively, then stick with a manual toothbrush. I'm going to do a bit of you. I've brought some bits and bobs to sort of wave around. So there are various other toothbrushes around. So we've got the Sonic and the rotary toothbrushes. So really, I don't mind. So we've got the Sonic, another Sonic,
yeah,
and the rotary there. So different kinds of electric toothbrushes that you can use. It's all about keeping the mouth as clean as possible. So whatever you find helps, then keep going with it. Some people find their mouth gets very, very sore, and these can't be used. So then you move on to much softer toothbrushes. So I think you've got a soft toothbrush.
Yeah, I've
There,
got one of the 2P special care ones, and I mean, these are super soft. I also, now this is the Curaprox Ultra Soft one, and again, soft, but not nearly as soft as this is. This is really, really soft, and I think you actually have the Curaprox surgical one as well, haven't you,
I
Joss?
do. I have, yes. So it's a
Yeah.
really great, there's great toothbrushes. Just keep using them, try and use them to try and keep clean. Now, if the mouth becomes very, very sore that a toothbrush however soft it's going to be is not going to work, then we need to at least moisten the mouth and try and remove plaque, because it sticks not just to hard tissues, it sticks to soft tissues too. So it might be that there might be something like these. Now I know the trust might be moving away from using these kind of things. These won't clean teeth, but what they will do is moisten the mouth. So these can be dipped into different, these are already moistened. These aren't, but they can be dipped into something that might just lubricate the mouth. So you might see these around, you might not, but they're different options. And people are trying to update things all the time to keep oral care as good as it can be. So yeah, different options.
Would you recommend, sorry interrupting there, Justin. Would you recommend anybody embarking on cancer therapy that they get a new toothbrush, or they, should they change their toothbrush, along the way more often than ordinarily, the usual 3 months, or if they've had a bad infection, should they change their head of their toothbrush? Is there anything there that they can sort of prepare for?
Well, I've read some articles that say that you should be brushing potentially up to 4 times a day compared to the 2 times a day. They say that you should be changing the toothbrush head or the toothbrush, the manual itself, every month. So it's all about keeping what you're using nice and clean, really washing off all that toothpaste that might be on there and any saliva and obviously the bacteria that gets harboured in these things. So keep that as clean as possible, but certainly, yeah, absolutely change it regularly.
Yeah, have you thought, I've come across some people who would advocate putting their toothbrushes or the toothbrush heads in the dishwasher. Now, I'm not quite sure how I feel about that.
I would say personally not. I have had patients that have said that, but actually just some people alternate toothbrushes, so it gives the toothbrush the chance to dry out. So if you're using manual toothbrushes, then yes, use one day, give it a good clean, let it dry, and use another one another day. So you can alternate it like that. I wouldn't necessarily put them in the dishwasher personally.
No, I have to say I'm not quite overly comfortable with that one, but I mean, I know there are some people that say that, and I actually was reading something recently that had that, and I thought, wonder actually, is there any evidence anywhere to support that? And that's one of the great things about Jocelyn is very much like myself, evidence-based advice. It's not something that we just pick out of thin air. I mean, I often say that I don't have an original thought in my head. Everything that I tend to pontificate about as far as oral health is somebody else has done the research, somebody else has done the work on it. I just regurgitate it. And I know Jocelyn also, I mean, as much as me, you have your area that you're particularly interested in, you've written articles and she's published stuff, you again are very much evidence-based, but it's a constantly moving stone, isn't it? It gathers more and more information every time we go somewhere or do something.
Oh, absolutely. There's always something to learn. There's always a new nugget to get your hands on and, learn about. So it's, even in 31 years, I'm still learning every day. You shouldn't think that you know everything, because you don't. I turn up to lectures and I always come away with learning something, even if it's not cancer related. It's something I've always learned, and I take it back and think, or it's a link to an article or something else I just need to have a little read up on. So yeah, lots of bedtime reading.
Yeah. I know. Sad, aren't we? Yeah, but in a good way. If anybody, by the way, has a question, pop it in the comments box and we'll pick it up just so that we don't miss anything. The other thing that I often find I get asked about in relation to cancer care is the use of mouth rinses, Jocelyn. I mean, I know, I constantly have this conversation with people who say, I don't clean in between my teeth, I use a mouth rinse. And I'm always saying that actually isn't going to do what you want it to do. But is there a place for mouth rinses and mouth washes during cancer therapy, particularly when the mouth is sore? And if there is, what would you suggest? Is there any ingredient we should be looking for? And do we use it forever, or do we just need to use it when we can't brush?
This is a huge topic, the mouth rinses and products that you can use during and after cancer treatment. You'll be guided by taste, longevity of it, and also price, different things like that. Some things are made just to line the mouth. Some things have got ingredients in them for soothing the mouth. Some things have got products in them for helping saliva production. So there's lots of different things to try. There's different ranges. I have got lots on my website and I add to it all the time, and there'll be even more out there all the time to add to. So I give my patients everything sample wise to try, and they will always come back to me and say what they do or don't like. It's very personal, but it's nice to know there's lots to try out there. Some are available
Yeah.
on prescription, some are available over the counter, and some are available online. It's very personal, but yeah, lots and lots of different things to try. I would always I would recommend mouthwashes going through cancer treatment, especially with dry mouth and with ulcers, because that lubrication can just help you eat your next meal, or be able to talk, be able to kiss.
Mm-hmm.
It's lots of different things that can help that mouth be a lot more comfortable.
And with that, would you say use it instead of brushing, or use it at a different time of the day, or what would you advocate as far as the usage of it? I do find some people that rinsing, my brain, what I think is mouse rinsing and what some people do is slightly different. So I had quite a funny one recently that somebody was rinsing, and I thought, that's not quite how I would rinse it. And this was their version of rinsing, was shaking their hand instead of this, which is what my sort of understanding is. But is there a better time to be using a mouse rinse?
I'd always recommend it not to be used at the same time as toothbrushing, especially if you've got a dry mouth. We want the fluoride from your toothpaste to be staying on your teeth. If you use a mouth rinse straight afterwards, it's swishing away all the good stuff that's in the toothpaste that we need to be using to protect your teeth. So definitely at a different time. This is guidelines, yeah, definitely guidelines from Public Health England say to use a mouthwash at a different time of day. There's sprays that you can use. Sprays are very helpful. It is all about how to apply them, how to actually use them. So mouth rinses, yes, definitely, as you were demoing there, Leigh, a good swish around, and then spit out the excess. Definitely at a different time of day. If patients are able to use something between the teeth and they're comfortable using that all the way through the cancer treatment, that's fine. Keep doing that. It's all about keeping the bacteria down. If you've only just got your diagnosis and you haven't been to the dentist for a long time, be prepared for a lot of bleeding. So you need to speak to oncology, and they'll probably recommend that you don't use something between your teeth while you're going through treatment. But that's current guidelines, but who knows, that might change in due course. I would like people to be using something between the teeth at least once a day if they can. It depends how tired you are, it depends how sore the mouth is, but if possible, that would be great. Mouth rinse, yeah, if you want to use a mouth rinse, different time of day. Different flavors, there's all sorts of things out there,
With or does it matter whether it's with or without alcohol?
I prefer it to be without alcohol, personally. I prefer it to be alcohol free.
Yeah,
Definitely.
mainly the reason why we tend to say alcohol free is because alcohol has a very drying effect, not only exacerbates everything else there that's already dry there. What I was going to say, but if I was starting cleaning between my teeth, and I sort of floss sometimes, and I know I really need to up my mouth care because I'm going to go through chemo radiotherapy, and I start to floss and there's a little bit of bleeding, is it okay to keep going, or should I stop and check with oncology?
I would check with oncology. Personally, healthy gums don't bleed, but because people are immunosuppressed, what you don't want is the bacteria, and it's to do with the white blood cell count, to then make sure that we're not disturbing things. So it's a very wishy-washy answer, but I would check with oncology. Go by their guidelines always, and we can always pick people up at the end afterwards and sort out gum health afterwards.
Yeah. And is there an increased risk of tooth decay during cancer therapy and radio and chemotherapy? And if
yes, there is. So ideally what we want patients, or the general public, ideally to be coming to the dentist routinely. Only 50% of the population actually come to a dentist routinely. So what we want to do is make sure that hopefully you're eating 3 meals a day, and anything that you are snacking on or drinking between meals is sugar-free, but also doesn't contain any acid. So as we're trying to move towards being a healthier population, we maybe might be having more smoothies, different kinds of squashes and things like that. So this can creep in between meals, and so raise your risk for holes in your teeth. Now with cancer patients, if their mouth is dry, they want to be trying to keep the water going in. They might try some squashes and different fruit juices and things like that. We also need to keep their weight up. So while they're going through treatment, nutrition is vital. So it might be that actually those patients need to eat, need to drink, whatever it is, as regularly as they can throughout the day. So yes, they're going to be high risk for getting holes in their teeth. If they have natural teeth, there might be quite a bit of root surface that's exposed. This is not as hard as the enamel covered part of the tooth. So this is highly susceptible part of the tooth. So again, very risky for getting what we call root caries. So we need the fluoride toothpaste to be on there. Ideally, there should be a high prescription fluoride toothpaste prescribed. It can help with dry mouth for all sorts of medications. There's papers out there that say that 2,500 medications can cause dry mouth. So I would say quite a lot of us, especially with something like what they say comorbidities, you might have diabetes or other complications which lead to dry mouth. So yes, a high fluoride toothpaste is, I think, essential for cancer patients going through treatment. Once they've finished treatment, then reassess, and if it looks like saliva and the mouth is back to normal and the diet's under control, then yes, back to a regular routine toothpaste. There are many options for different toothpastes out there, different ingredients, again, taste, pH, so it depends if some products might be slightly acidic, but some things are acidic because they're saliva stimulants, so we have to weigh things up, but it's about keeping these teeth healthy. The other thing I was going to mention was dentures.
Yep, very important.
I was going to mention dentures. So I did it right, brilliant.
We're like the best food at your workshop, aren't we? One we made earlier.
So this is an acrylic denture, and this is a chrome denture. So you might see or might have or might know somebody with dentures. So it's vital that these are kept clean because these will harbour plaque very, very easily, and they're in the mouth. They should be taken out at night and given a good clean and then left in water. Now, this is a denture brush. Have you got one of those?
I have one of these too.
Dun, dun,
we can go get
it. So various different denture brushes, shapes, sizes. We need to be getting into these areas to get these really nice and clean. So there may be food debris in there because the patient, when they have a very dry mouth, will harbour not plaque, but food debris as well. These need to be clean. So it's a bit like taking your shoes and socks off at night. Lets everything breathe. So give them a good clean into all those nooks and crannies. So I'm very grateful somebody's loaned these to me. And the other thing to remember is that if it's yourself or somebody you're caring for that might be in and out of hospital and they have dentures, try and get them like a little mouth guard box. Have you got one, Leigh? No.
Do you know something? I have one here and I took it down the stairs. Oh, I haven't got my hand on it. Sorry, Jocelyn. Oh, hold on. I'm not to be thwarted. Give me a second. Yeah. Oh. Here we go. Excuse the banging. There we are.
Great. So that's a denture box or a mouth guard box. Go for the brightest colour you can. There's many, many dentures that are lost in hospitals every day. And it means that the patient can't eat and drink because they haven't got their dentures. So anybody who's going into hospital, whether for cancer treatment or for anything else, please have a box like Leigh's showing you there, label it, put the name on it, make it as funky as you can so they're less likely to lose the dentures because these are vital, absolutely vital, but they need to be kept clean. So a good denture brush. And what I recommend patients to clean with is soap and water or a denture cream. So that's an option, but good soap and water just in there. Do it over a sink full of water. So anytime that falls into the sink, there could be little bits of this that might break off. So if it falls into the sink of water, it's less likely to break. So little option, but dentures are really important.
Yeah. Anything that you put in your mouth, whether it be a denture, whether it be a night guard of some form, whatever you would put on top of your mouth, it needs to be clean, and that still needs to be worn throughout your cancer treatment. But dentures in particular, they have such an impact on people's quality of life from the point of view of their self-confidence. And I mean, they're already, I mean, they may have hair loss, they may have a whole lot of other things that are side effects to their cancer therapy. You not being able to smile with scissors and things is a huge impact on them. And even more important is their nutritional status, their ability to chew and eat properly. So, I mean, if you can find somebody where there's an option, I mean, I know in the past that some of the community dental services have offered denture marking for anybody that's going into hospital, so at least they can recognize their own. I remember hearing a horror story about people just gathering all these different dentures and then giving them back to patients, and not necessarily the right denture for the right patient. So yeah, it is really important that they're marked, that they're accessible, that they are well looked after, and really make sure they're taken out at night. And that's goes for anybody. It doesn't need to be anybody that's just had a cancer patient. If you wear a denture, it should be taken out, cleaned at night, and stored to give your mouth a break overnight. That is great. Anybody any questions at this point? I mean, feel free to chip in. You know, Jocelyn and I could probably talk all night if we're left to our own devices. Yeah. Actually, having dental treatment, Jocelyn, who should they see and how often? Should they have shorter recalls? Should they have, you know, less time in between appointments during treatment, or, you know, before and after?
Well, this is the thing with cancer treatment and white blood cell count. It's very difficult to know when to see the patient. So I always get guided by oncology. So if I have a patient that turns up because they've seen me or the dental practice as a priority, it's so important that we don't turn them away. They get very tired during treatment, so they thought, I'm going to go to the dentist, I'm going to have my appointment as I've booked it. I won't turn them away. We have a cup of tea, we have a chat, and we talk about their oral hygiene, we see if there's anything I can help with. But yes, I'd like to see patients before they start their treatment, and then I see them afterwards. And let's say for some patients, chemotherapy will go on forever. So we have to find a time when it fits in with their cycles, when it's okay to see them. So I will be guided by oncology about that. And then, you know, gradually build up a rapport with your local department, your local specialist, so that that rapport is better and flows better. So from primary care to secondary care. There was a big talk about that at the oncology forum, which I thought was fantastic, because it is all about ongoing care.
Yeah,
So,
and that's the thing, you know, with our cardiac patients, they are often recommended that they go to the dentist before they have any treatment. You know, that always seems to me that the medics and the nursing staff and, you know, other healthcare professionals should have oral health care in their mindset, preparing patients for the cancer therapy. Would that make sense? What do you know?
Definitely. I mean, I've met with some fantastic healthcare professionals at Gloucester Royal recently, and they're all there talking about mouth care. They're from different areas of the hospital, different levels of seniority, different levels of experience, but they all know how important mouth care is for all of those patients. So it's really important that we can all work together, a lot more collaboration. Personally, I think mouth care and dentistry should be taught a little bit at medical school. So when they go off on their specialisms, wherever they're going, they will be thinking about the mouth at the same time. It's priority, you know, the mouth is so important. It's not a separate entity. It's connected. We can tell a lot of things by the mouth that might be happening somewhere else. It's all about inflammation in the mouth. If we can keep that as low as possible, it can help other areas of the mouth. Your mouth is sore. It's not nice that you can feel it. For us, we know with a tiny little ulcer, it hurts. For our cancer patients, potentially they might get larger ulcers, be ulcerated more. You know, it all depends, but it can be not very nice. So it's important that we all work together as a team.
Yeah,
Mouth care matters is something that's very growing throughout the country. I think there's 33 trusts now that are all coordinating with Mouth Care Matters and Mini Mouth Care Matters. So it's all about youngsters as well as adults. So it's going to be amazing.
And it is working together, because there's things that have changed over the years, but one of the things, and Rachel has just brought us a really good question, actually, because you often hear this with Macmillan and a number of the charities that support cancer patients about the costs of things. And she's asked us, what about the cost? Do patients undergoing cancer treatment get free dental treatment, or do they still need to pay for checkups, etc.? And she's apologised. It's an awkward question. No, it's not an awkward question, Rachel. It's actually a really good question. And it is a worry for any cancer patient and their families, whoever's supporting them, because they've got the costs of getting back and forward to appointments. And then if something's going to, they're going to have to buy something and they're going to have to spend more money, maybe when there's no income. So, I mean, you probably know, again, much more about entitlement for expenses and costs of NHS dental treatment.
I don't work in the NHS, unfortunately, so I wouldn't like to misquote. But when I've been to Macmillan Days, there's always somebody there to talk about finances and to see how they can help people out with these things. So I'd always say contact your clinical nurse specialists, have a good conversation. They often have open days. There's lots of points of references and people that you can actually speak to. So I wouldn't like to misquote what people are entitled to and what they're not entitled to. It's a massive topic, huge topic. Yeah. So, yes, sorry.
It is. No, it's an awkward one, because how the NHS, how treatment is funded is different in different parts of the UK as well. So it's not something that there's a blanket answer to. So, you know, the best thing is always speak to your oncology team, as Jocelyn says, your nurse practitioner, contact Citizens Advice or some of those groups who, again, will be able to say, right, well, you're going to be entitled to this, or this, because it can be a very expensive time if you have to travel for cancer therapies, and then you're coming back and you're exhausted. Now, you know, NHS, I mean, if you're an NHS patient, dental patient, I don't think that changes at all, Rachel. I think you still have that sort of entitlement of what your NHS dental checkups and things would usually be involved. Hygiene care, dental hygienists, you can get some dental hygiene treatment under the NHS, but it is one of those things that it is probably worth looking at the investment to see somebody privately. It's a tough one. I'm sorry, Rachel, that's maybe not exactly what you wanted to hear, but again, there are people that advise as far as finance goes, and it's a difficult one, because even some of these specialist toothpastes and toothbrushes, it all adds up. And I know I mean, one of our most favourite on the online shop, the Grown Smiles online shop, one of the most popular products for dry mouth are the xyli melts. And people use these long term. Now, they're not the cheapest product on the planet, but by goodness me, they do seem to help people get a night's sleep, you know, whether they have a dry mouth because of cancer therapies, or, you know, the polypharmacy, so they take a whole lot of medications, or patients who use CPAP, so sort of a breathing type machine. They're really good for that. But, you know, it's one of those extra costs that, you know, is a cost between, do I eat or do I use these? It's a really tough one, and that's where the likes of Macmillan and the financial, you know, the charities that have financial advisors are so good. I don't really need to add to that, Jocelyn.
I can't. I mean, I would, yes, definitely go and visit all of those avenues and get as much advice as you can. It is a problem, and I always see somebody there who's willing to speak at the Macmillan days. So yeah, as you
Macmillan
said,
folk are they're particularly good. We've got another one here, Jocelyn. Ulcerated mouths and foods that are going to actually not aggravate inflammation or not make it more painful. So anybody of you who are thinking what this might be like with a mucositis, it can be the whole of the mouth breaks down and becomes really ulcerated. So if you can imagine you have an ulcer and you have salt and vinegar crisps, can you imagine how that's going to feel? Your whole mouth's like that. So are there foods that you would recommend, Jocelyn, that would be more bland, that would actually not irritate? Yeah, this was a brilliant. Yeah, it actually was a GP friend that actually popped that up, or did I can't remember. I found it somewhere and I posted it on the Grown Smiles, I think, at the Facebook page. Yeah, really good. Jocelyn, talk us through it, though. I haven't physically got one, you have.
So, well, I'll send you one. I'll do you a favour. So this is a lovely book that was created by a lovely lady called Brenda, and it's been created with lots of amazing recipes in there, because sometimes people just can't cope with lumpy food, can't cope with certain textures, certain ingredients, things like that. And so it takes you all the way through, from soups to different starters, main courses, even desserts, which is amazing because nutrition is vital. So this is one of many that are available. I mean, I'm passionate about this one because this raises money for the Mouth Cancer Foundation, of which I'm a clinical ambassador for. But it's a great one to get. You can get this on Amazon. There are many online, many recipes online. Again, there's plenty of other resources. Ryan Riley, he's actually traveling around the country, so he's doing his bit with his cookery school. So he's teaching cancer patients how to cook and use different flavors. So some people actually want to go more spicy. Some people actually want to go overboard with some of the taste because their taste buds aren't as good as they should be when they're going through treatments. Whatever you need to do, you need to do, and it's vital that you keep healthy. So there is options out there for help, but with mouth ulcers, yes, it's not pleasant, not pleasant. So we need people to be eating and drinking as much as possible to keep their weight up and get them through that journey. So that's an option. I'm glad I showed you that.
Thank you. Evelyn has given us some advice about what the situation is with checkups in Scotland. So in Scotland, checkups are free. If someone is on benefits, so universal tax credits, then treatment will be free. If paying for treatment, then an HC1 form can be completed, and this will come back and let you know if you're eligible to get help with fees. If you already have paid, then HC5 form will allow you to claim back any fees that you pay. Evelyn, thank you very much for that. That is a really, really helpful thing to know. See, we're learning every day's a school day.
Every day's school day.
That is
Absolutely.
really, but it's one of those things that I know people worry about. I mean, and I know my background in the hospital, working with oncology patients, it was such a dramatic change. They were diagnosed, they were sent over to the dental school. If they had any questionable teeth, they were extracted. They were given some advice, and they snowballed to starting their chemo and radiotherapy the following week. And it was just so much to take in and take on board. But the one thing I always say about mouse care in relation to cancer treatment is this is something that you and the people immediately around you can help with. So there's so many other decisions being taken for you. And you're being told you have to be here for 8 o'clock in the morning, you have to have that, you have to do this. But you know something, your mouth care is something that you still have a bit of control over. And it really does make a difference. We often talk about your mouth. It's the gateway to the rest of your body when you think about it. If it goes in here, it's going to end up in some other part of your body. Your mouth is a huge reflection of your overall well-being and your health. So, it's worth looking after, because the knock-on effect of it being problematic, particularly during cancer treatment and after cancer therapy, the consequences really can have quite severe long-term impacts. So it's always worthwhile having to think about that. If you start ahead of the game, ahead of the curve, then it makes the whole cancer journey much easier.
Absolutely, yes. It's probably last thing on the list when you get the diagnosis of cancer, but obviously I'm a dental person, but it's really important that it's nearer the top. I think there's a booklet that Cancer Research UK can often give patients. It's about their treatment plan and their journey, so they can take it each time. And actually, healthcare is about halfway down that list. So that's good. That's good. So we're getting there. We're getting there. But we've all got to work together. It's all teamwork, and it's about keeping our patients healthy and keeping their mouths healthy and as symptom-free as possible.
Yeah, because it really is during cancer treatment of managing those symptoms and preventing the consequences of those things. So the dry mouth can lead to more tooth decay. It can lead to more gum inflammation because you're missing saliva, and saliva is one of those things that we just don't give enough credit for unless it's not there. And it's only when it's not there that you actually suddenly realize how important it is for chewing, for swallowing, for lubricating, for speech, for all the little things. Even if you think you're wearing dentures, if your mouth is dry, you're more likely to have friction and trauma. So all these little things that in and of themselves don't seem overly important, taken all together can be really unpleasant during cancer therapy. So, you know, it is about trying to, you know, get ahead of the curve, get to see your dental team. And I don't just mean seeing your dentist, see a dental hygienist, get your mouth in shape for what's coming. And that will help you actually get through those stages better in the longer term, because, you know, we are all, you know, more people are living with cancer than dying from it. And long term, there can be some long term effects of cancer therapies. Jocelyn, maybe you can sort of elaborate a wee bit of what the most common problems are after treatment. You know, so you're told you're cancer, you're clear of cancer. What's next?
Long-term problems, well, dry mouth really, I think. Also generally tend to go with the active phase, and you tend to come through that and out the other side. But dry mouth can be a long-term problem, but the dental professional will pick up on that. A lot of patients, when they're going through treatment, are fatigued, and it's trying to balance up everything, you know. They're tired. They're very tired. They're trying to contemplate everything else, plus cope with their treatment. It's a tricky one, but yes, we want to see the patients long term afterwards. Like you say, 1 in 3 to 1 in 2 of us are going to get cancer. Older generation, much older, growing population. So it's going to hit plenty of us and people that we know. Certainly I've noticed more of that now, you know, so in another 20, 30, 40 years even, you know, who affect around me, and I want them to be healthy and I want them to cope and to carry on living. Sometimes people are on chemo forever. It's just part of their treatment, and some cancers are not going to be called cancers anymore because they're long-term illnesses or diseases. So a lot is changing, lots happening with lots of different technologies. Some amazing scientists out there that are creating lots of great, so some chemotherapies are not starting to affect their mouth, which is great. Some head and neck cancer patients, they're starting to take away the mask, so they don't necessarily need the mask for that kind of treatment. There's lots of things that are changing. There are some amazing scientists out there, so really pushing the boundaries. And I think that's amazing.
Yeah, oh, it is indeed. I mean, the research that has evolved so much, even in the last 20 years. Maybe talk a little bit about mouth cancer, because I know you're an ambassador, and you do so much work on mouth cancer. I mean, what should people be looking for if they're concerned about mouth cancers? Because it does seem to be more common, and you know, why are we seeing more patients with mouth cancer, and in some cases quite young people with mouth cancers? And I mean, what should they look out for? What can they do themselves? And then, you know, who do they ask? Do they go to the doctor? Do they go to the dentist?
Well, so what we need to do is regularly check our mouths every month. So if there's any lumps or bumps either in the mouth, or any sore patches, or any ulcers, or anything that's been there for more than 2 to 3 weeks, you must have it checked. Now, whether you go and see the doctors, or whether you come and see the dental team, so you can ask anybody to have a look around your mouth. If something doesn't feel right, you must have it checked. The sooner we get to see something in the mouth that doesn't feel right, the sooner we can either potentially refer you if we're not happy about something that we see, or we can put your mind at rest. When you come for your checkups, what the dentist will do is they will check inside the mouth. They'll check all the soft tissues as well as the teeth. Dentists aren't just about teeth, it's about the lips, it's about all the glands that are under here, all around the neck. You should generally, well, always be having these areas being palpated at every checkup. If anything doesn't feel right, they might just say, well, have you had a cold recently, or anything, you know, might have had a cold sore or something that doesn't feel right, and so you get a bit of a raised gland or something like that. The dentist will know what feels right and what doesn't feel quite right. So you yourself check your mouth routinely. Again, anything that you spot, have it checked, but the dentist will check, all the dental team, so I'm not talking about dentists, I'm talking about hygienists and therapists as well, will check around the head and the neck to see if there's anything that doesn't feel right. So I feel very privileged when I see my patients routinely, because I do see them routinely. Anything that I spot that doesn't feel right, I'll say, can you just come and have a look see at this for me? I'm not too proud. I'm quite happy to be said, oh, you know, that's fine, or it's not fine. I'm quite happy to have that checked. But I need the patient to come across the doorstep. And as I say, only 50% of the population actually go to the dentist. It needs to be much higher than that. There's a drive for little ones under the age of 1 to be coming to the dentist. So it becomes a good routine, good healthy routine. So if anything is spotted, it's spotted early. But don't be afraid. If you do feel something isn't right, anybody will check your mouth. Please come and let us check it. If you want to go to the doctor, go to the doctor. Come to the dental team, whoever you want to see, please come and get it checked. There is a growing mouth cancer because people are drinking, people are smoking. Ideally, we'd like people not to smoke. We'd like people to maybe drink less or maybe not drink at all. The two together can actually create a much higher risk of having mouth cancer. And there's also the risk of HPV. So the HPV is a sexually transmitted virus. The girls have their HPV vaccination to look and talk about different kinds of practices that we are having, and so the risk in the mouth raises with HPV virus. So sometimes we've all got HPV, it will disappear, it will come back, but if we're not careful, there might be lumps and bumps that we need to have checked. So any problems, please come and see us.
Great, yeah, that's really useful, Jocelyn. We've another question here, Jocelyn. Angela has asked, and this is one that I know you have been asked before, how long should a patient wait after chemotherapy for dental treatment, including hygiene treatment? So how long from them finishing the chemo can they go and see the dentist for treatment and see the hygienist for
here's my very wishy-washy. Okay, here's my answer. It's going to be very wishy-washy because every patient's different. You think about all those chemos and the types of chemos that they're using. Every patient's going to be different. Wait, I would like more cohesion between oncology to say, right, now you can go back to your dental practice. That's what I would like, rather than the patient coming and we're not able to see them because I'm not sure whether I should see them or not. So I would like oncology, always give oncology a tinkle saying, is it okay if I see this patient? They will say to you yes or no. So there's no any strict time after treatment's completed. It all depends on their blood count. And we don't check that in general practice. So I have to be guided by the professionals and the specialists.
Right. And what, yeah. Okay.
So that's
my
answer.
I know what you mean. Hopefully that helps, Angela.
Answer.
So, I mean, is it straightforward enough in your experience to ring the oncologist? So if you have a patient comes through the door to the dental practice, Jocelyn, for their appointment,
well, I will always check. I'll either say to them or I'll check with the dentist.
I mean, if you ring them up, is it going to be one of these things that you're not going to know on that day? You're going to have to reappoint the patient?
It depends who you speak to when you ring the department.
I'm not sure. Can you hear me, John?
I can hear you. Can you hear me? I can hear you. Can you hear me okay?
Hello?
Hello? Can you hear me?
I think we've got a time lag.
Can you hear me?
Mm-hmm.
You can hear me?
Yeah, I can hear you. I think we got. Hello. Yep. Okay,
hello.
Right.
Can you hear me?
Yes,
okay?
I think we're both. Thanks, Rachel. Rachel's let us know she can hear us both. I don't know. We have a slight hiccup there. Are you okay? Yep, I can indeed. So
I'm fine. Thank
apparently
you.
we are now loud and clear.
So yes, it's a very wishy-washy answer when to see the patients after.
Oh,
it is a bit
technology.
I wish there was just more of a better journey for the cancer patient once they come back to us, because they're seeing us as a priority in their onward journey. And so I don't want that to stall. I want them to come in to carry on as we do, you know. I think I'm hoping that's going to improve.
I think we've got each other.
Can you hear me?
Yes, I can hear you.
I can hear you.
I don't know. Yeah, I think we might have got it back again. I'm sort of loath to go messing around with this, but yeah, I mean, it's really hard when we want patients to attend, but we want them to be well when they do attend, and you're better safe than sorry. The bottom line is, though, you know, oral hygiene instruction, you're not going to do any more helping them to make sure they're brushing properly and doing their daily home care. And sometimes that little reminder, just knowing that they can do that, makes it worthwhile the visit. And if they're worried that, you know, they've got, you know, that they haven't been for a while, um it is worthwhile keeping in touch or ringing the dental practice first and saying, you know, does that
Their
make
journey
sense?
carries on. You know, some patients don't want to talk about their cancer. Some people are right, that's up with anything you might have that you might suggest, or just ask how they are. You know, have a cup of tea if you get time. I know it's easy for me in private practice, in NHS practice, really strapped for time. So just do what you can. But yes, we need more collaboration, so that step from oncology back to us is smoother. Hello, Lee. I've lost you, Lee. Hello, Lee. Hello, Lee.